so often that I'm working with my patients who have MS in the clinic or outside of the clinic, there's so many questions that I get surrounding what do I do if this happens or if I'm feeling this? And without having a solution, it often results in not exercising and isolating yourself, not participating in the things that you want to participate in. So, what I'm going to be focusing on today is basically what to do ifs. So, we're going to be troubleshooting a bunch of different situations. So, let's go ahead and dive in. Okay, so as I mentioned, we're going to be reviewing troubleshooting specific situations around exercise and physical therapy or physiotherapy and multiple sclerosis. So, for example, what to do when blank happens. And we're going to be discussing how to handle the unknowns because when symptoms get in the way, as I mentioned, it often results in just stopping and avoiding the situation, avoiding the exercise. And in the long term, that can often result in getting weaker faster, getting more unbalanced faster. So it's such a good idea to have a few solutions in your back pocket where you feel comfortable, where if this does happen, you've got something that you can do. It doesn't mean that you need to stop and not do anything. So I'm going to be running through things like if you're too fatigued, what do you do? If you can't get to physiotherapy or physical therapy, like if you can't get to the physical clinic, or this could also be if you can't get to the gym, or if you're overheating. Heat intolerance is a very common symptom in MS. Hopefully, as we all know, heat intolerance is more so when something, not just the temperature outside, but something causes your core temperature to increase by at least half of a degree. And when that happens, symptoms can flare. And guess what can increase your core temperature by at least half of a degree? Exercise. So, we want to make sure that you have some tips to manage heat intolerance if you do feel like you're starting to overheat. If you can't feel your feet or your hands, so more of a sensory change, if your symptoms are flaring, if your spasticity is high, how to prioritize which exercises to do. Some of you guys may have been to physical or physiotherapy before, and you might have a list of like 50 different exercises, and you're wondering, well, what do I do? How do I even start? Where do I jump back in if I did fall off track? What's most important? So knowing what to prioritize is really important. When you're used to doing non-neuro based exercises. So these are the main topics that I get questions about, probably, if not a daily basis, that one of these comes in at least a few times a week. So we'll cover these, and hopefully you'll feel like you have some solutions in your back pocket. Starting off with, if you are too fatigued, it used to be reported that up to 80% of people with MS suffer from fatigue. Now they're saying 90 to 95% of people with MS suffer from some form of fatigue. So we've got to have a management tip and trick if you're feeling too fatigued. And let me first start off by saying that you know your body and your energy levels best. There are absolutely times where if you're feeling fatigued, rest is okay. So please don't feel like with the tips that I'm about to share that you have to exercise if you're fatigued. I'm going to give you suggestions on if you want to exercise when you're fatigued, but resting is absolutely okay. The only time that that becomes a little bit, how do I even want to phrase this? We don't want to rest too long to the point where then you're getting into a habit of not exercising ever. But that's going to look different for everyone. For some people, if they take 1 week of resting, they're able to jump back into their exercises the next week. For other people, if they take 1 week of resting, that really throws them off and they don't jump back into exercising for months. So this partially has to do with your personality as well. but resting is okay. I would just encourage you to make sure it's guilt-free rest. Because if you are feeling guilty, if you're feeling like, oh, I should be exercising right now. I should be doing XYZ. I should be going to the grocery store, but instead I'm sitting here or lying here. It's not as restful. I don't know about you guys, but when I feel guilty as I'm resting, when I'm done resting, I don't feel rested. And so I highly encourage you to try to remove any guilt you have around that rest. Okay, now let's get into what if you do want to exercise, but you're too fatigued. So, first and foremost, do seated based exercises. Seated exercises are my favorite, anyways, because we can do them throughout the day. If we are at work, if we're sitting at home watching TV, if we're scrolling our phone, we sit a lot throughout the day, MS or not. And so, if you have seated exercises, they're easy to implement. But when you're fatigued, they're a great exercise option because you don't have to worry about balance as well if you were standing up. So, seated exercises, it could be things like seated marching, seated leg kicks, it could be upper body exercises. We've talked before about cardio, but cardio can be upper body movements like this or upper body like this. So just really slow and controlled, low aerobic expenditure. So just moving slow and steady. If you're doing cardio on a high energy day and you're doing this move, you might feel like you can go really fast and you're keeping your core tight and it's getting your heart rate up. On a fatigue day, maybe your focus is just sitting up tall and slowly moving your arms forward, depending on how fatigued you are. So, seated exercises, low aerobic expenditure, so just moving slow and controlled. You can also use tools to help. There are so many tools that can help with exercise and mobility. So, some examples might be electrical stimulation. The dictus band is something that I like to use for foot drop. Maybe on the days you're more fatigued, you're using the dictus band. Or a mobility aid, maybe you're using a walker or a rollator or trekking poles on those days. Because if you're using some tools to help, that oftentimes will make you feel more stable and therefore less fatigued because you don't have to worry about stabilizing yourself. You're using something else that's helping you do that. So there's no shame in using tools to help. Focus on the least fatigued areas. So check in with yourself on these fatigue days and ask yourself, okay, how is my upper body feeling today? How are my arms feeling today? And what answer comes to you. You could even get more specific. How are my hands feeling? There are some clients that I have that I work with where on their highest fatigue days, one of their exercises is opening and closing their hands. And it just gets the blood flowing, it gets everything moving, muscles activating, and they're usually doing it down here, but you couldn't see me if I do that, so I'm just showing you up here. But their hands just resting on their lap. Are your hands feeling okay? If so, let's move your hands. How are your elbows feeling? Could you do some weightless bicep curls? How are your shoulders feeling? Can you move your shoulders around? Can you do some of our upper body jumping jacks? If your arms are shot, if your arms just feel heavy, dead weight, you just cannot move them, how is your core feeling? Could you sit up tall, away from the back of your chair? This is an exercise. Can you do that on your fatigue days versus resting and relaxing like this? Can you sit up tall? How are your legs feeling? Legs are usually feeling pretty heavy on fatigue days, but everyone is different. If they're not, maybe you can do some toe lifts and heel lifts. Maybe you can lift your leg up and down. Maybe you can straighten your knee and bend your knee. What can you do? Focus on moving the least fatigued areas, not the hardest ones. We're trying to make movement easier on these days. My first answer when someone says, I'm too fatigued to exercise, is very rarely rest. As I mentioned in the beginning, rest is absolutely an option. But usually, I like to try some movement first, because exercise has been shown in lots of research, specifically in people who have MS, to reduce fatigue. So typically, my first answer isn't, okay, just take a rest day or don't come to physical therapy, unless it's extreme fatigue. And again, you know your body best. If you feel like it would be unsafe, take a guilt free rest day. Other times, though, I would encourage these specific parameters: seated exercises, light aerobic movements, super. You could even do these in bed. You can do these from a comfy couch or sofa, light movements, and see if it actually does help your fatigue, and then go from there. If you can't get to physical therapy, or if you can't get to the gym, if you can't get to the park or the place that you like to go for exercise, and there's lots of reasons that this could be the case. One reason why I started my online program and teaching virtually is because so many of my patients with MS couldn't get to physical therapy. And so I needed to find a way where I could educate them in their own home. And it's the same for you. If you can't get to PT, to the park, to the gym, wherever you want to go, have an at-home option. So have a home exercise program that you can do. And I always recommend having two different programs. One for an easier day and one that's for a harder day. And a great example of this would be if you're having a fatigue day, like we just talked about, but you only have one exercise program at home, then you might not exercise that day because it's too hard for you. But if you have an easier exercise program for you to do, it will be so much easier for you to say, you know what, I'm a little fatigued today. Let me grab my easier day or my fatigue day routine, and I'm going to do that. And then if you're having a more energized day, then you can pull out your harder day. So having at least two different options. For some people, if your energy levels or symptoms really vary, I might even help my patients create three different programs instead of just two. So work with the physical therapist or someone that you know, love, and trust to give you functional exercises to help you determine what those different plans might look like for you, because everyone is going to be different. But making sure that your home programs, whether it's the two or the three, or even if it's one, make sure it only includes things that you have at home. If you don't have resistance bands, do not include resistance band exercises. If you don't have weights like handheld dumbbells, don't include dumbbells. So be strategic about what you're using and not using. And I get really specific with my clients that I work with, where I even tell them where they're going to sit. So on Mondays, or on their, let's say, their easier days, they might be sitting more on a comfy sofa or couch, because generally that might be a fatigue day for them. So they're going to do their exercises from the couch that day, or from bed that day. What exercises can you do from your bed or your couch? And you guys don't have to know this. This is where you would work with someone to help you create this. But only use equipment and things that you actually have inside your home. Because again, on these days, there are days that you can't get out for whatever reason. Maybe it's transportation, even. Maybe it's not symptom related, but finding something to do at home is really important. Oh, and then making sure your home exercise program is manageable as well, even if it's just two exercises. So often, if I were to poll people and say, how long do you think an exercise routine should be? Or how long do you think you need to exercise to feel productive, to feel like it was a good routine? So often, what I hear is 30 minutes, 45 minutes, 60 minutes. Yes, those are good answers. It's a great amount of time for exercise, but it's also productive to just do two exercises in 5 minutes or less. Maybe you do that a few times throughout the day. It doesn't have to be all at once. So, making sure that whatever you do have for your home program feels doable and manageable to you. Again, if it doesn't feel manageable, you're probably not going to do it. So, just keep that in the back of your mind as well. If you're overheating, again, overheating can lead to heat intolerance, which is when one or multiple symptoms worsen due to your core temperature rising by at least half of a degree. Half of a degree is so minimal. I remember when I first learned that research, I was like, what? There's so many things that increase stress, increases our core temperature more than half of a degree. My response that I'm having right now of just this shock is probably increasing my core temperature by at least half of a degree. So many things increase our core temperature. And exercise is a big one. So if you're overheating, use cooling products, cool yourself down before, during, and after your exercise routine. This is especially important on warmer days, but even if it's the dead of winter, heat intolerance can happen at any time. So find some cooling products that work for you. There are lots of different options depending on how overheated you are feeling. There's vests, there are just wristbands. I really like the wristbands for the days where you're feeling a little overheated, but not too bad. You just want to get ahead of it, or you're just being proactive. They have necklaces that can freeze in your freezer, and then you put it on and it keeps your chest nice and cold. They have hats. They have cooling gear for women who wear bras. They have cooling like ice gel packs that can go in your bra to keep you cold. They have everything that you could think of. So find some things that you think might work for you and utilize them before you even start exercising. The trick here is we don't want to wait until you're overheated, because then we're cooling you down. Ideally, we cool you down first, then you exercise, and then you stay cool so your symptoms never actually flared, versus being retroactive and you had too much heat, your symptoms are there, so now we're trying to retroactively cool you down to reduce your symptoms. So find something that works for you. Also, more water breaks, ice cold water breaks. Room temperature water, generally speaking, is really great for our gut health and for our body overall. But when we're talking about our core temperature rising, water breaks can be so important with ice cold water and just tiny little sips. It doesn't need to mean that you have to guzzle 8 ounces of water, but just tiny sips of ice cold water can be really helpful. If you can't feel your feet or your hands, and this is a really important one because so often when you're going to physical therapy or when you're exercising, your mindset is on strengthening and balance and walking. And those are great things to have your mindset focused on. But if you can't feel your hands or feel your feet, your exercises likely won't be as beneficial because you're not getting the tactile feedback. Having good sensation in our hands and feet play a huge role in our ability to utilize our hands and feet. And feet is a big one because if you have a goal of improving your walking, but you can't feel your feet, we've got to work on sensation first, typically. Same thing with your hands. If you tend to drop things, one reason you might be dropping things potentially could be you don't have as much sensation in your hands. So whether it's feet or hands, if you have numbness, tingling, burning, pins and needles, reduced sensation, anything like that, you'd want to focus on desensitization exercises. And what this means is you're trying to desensitize the area. So it's a pretty simple concept. You would grab something that makes your sensation worse. And I know that might sound a little weird, but that makes your sensation worse. And I'll just demonstrate on my hand because that's easier for right now. And I happen to have this little scrunchy hair tie here. So this is very soft. It is not something that would normally bother me. But let's just say in this case that soft things do cause my hand numbness to worsen, or it causes whatever sensation I'm feeling to exacerbate a little. What I would do is I'd grab this scrunchie. It could be a cotton ball. It could even be the fabric of my shirt. I could do something like this. And I'm just going to rub my hand. I'm going to rub the area that is feeling sensitive. I can tap it. I can go up and down. There's no real rules, but you're finding a material that makes the sensation worse, that sensitizes it even more. And you're going to stick with that for about 3 to 5 minutes. And what you should notice is that by the time the 3 to 5 minutes is over, it doesn't feel as bad. And what that's doing is it's desensitizing you. And what is happening is initially, when I first touched this thing that bothered me, my brain, specifically my reticular activating system, was saying, whoa, Dr. Gretchen, what are you doing? That hurts. Stop doing that. I don't like this. No, no, no. And it's like a little kid throwing a tantrum. It doesn't like it. But then the longer it's there, the more it realizes, oh, I'm not dying. This is okay. My hand is not on fire. This is okay. I can deal with this, essentially. And so once I feel like this doesn't bother me anymore, then I grab something else. I just happen to have this stone, this crystal here. Again, this is a soft material, but it's different and it feels colder. So now we're kind of going to a cold temperature versus a neutral temperature. Same thing. Rub around, tap, and you're just going to do this with lots of different textures that you find bother you. You could use, this is a pen cap. You could use a pen cap. This end is going to be a little bit sharper. And I put quotes around that because it's not that it's sharp, but it's sharper. It's got edges compared to this side. So maybe you use something that has a sharper edge in a safe way. Like if you were to use a hairbrush, you'd use the brush part. You would use that as the sharper end. You'd flip it over and use the backside as the other end. So finding things that you have in your home to desensitize the area. One of my favorite things to do is a bucket or a Ziploc bag of dried rice and or dried beans, and you put your hand in or you put your foot in and you just move it all around. The reason I like that is because dried rice has sharp edges. Dried beans are very soft and smooth, but it depends what you use. If you use dried lentils, sometimes those can feel a little sharp around the edges too. So you're just putting your hands and or your feet in these situations where normally it would be uncomfortable, and you're just allowing it to desensitize you. So um, try it out. It's something that will feel weird at first because, as I mentioned, it does make the symptom worse at first, but then it should get better over time. If your spasticity is high, spasticity is one of, I think, the most annoying symptoms of multiple sclerosis because it always wins. It doesn't matter how strong you are. If you have really high spasticity, that's always going to trump the strength that you have or the balance or your mobility. So if you feel like, oh, my spasticity is so high today, I can't do any exercises or I can't do my normal routine, here's some solutions for you. Number one, if specifically you feel like my knee won't bend or even my elbow won't bend, if something won't move in the way that it normally does, there's 3 main options that I like to look at. Number one is stretching. And you want to stretch the specific muscle that feels tight and spastic. I'll try not to get off on too much of a tangent here, but so often I will have clients say, Dr. Gretchen, I don't know why my spasticity isn't improving. I stretch all day long every day. But when I ask them what stretches they're doing, they are indeed stretching all day long, but they're not doing a stretch for the area that they have spasticity. So of course their spasticity is not improving. Not only that, I'll then ask them, how long are you holding the stretches for? You're doing them throughout the day. Are you holding for 5 seconds, 20 seconds, 60 seconds? And without fail, most of the time they say 5 to 10 seconds per time. Well, that's not long enough. You really have to stretch at least 30 seconds, if not up to a minute, and 3 times on that same side in order for it to be effective. And that's just one round. So you could do that 3 times throughout the day or 5 times throughout the day. That would be more effective than stretching for 5 to 10 seconds 50 times throughout the day. So, knowing what muscle to stretch and how long to hold it, which muscle to stretch is going to depend based on where you personally are having spasticity. So, stretching is one option. Another option is massage. Lots of different ways that you can get this. You can use, let's just say it's your leg, you could use your thumbs and massage out your thigh or whatever area it is. You could use the heel of your palms and massage out. So you could do it yourself. You don't need to go to a masseuse or a massage therapist. You can massage yourself. You could grab a tennis ball and roll that around. You could even grab, this is a little bit too small, but you could grab a thick pen or pencil and you would put that and press down into the tight muscle, and you're doing more of a trigger point release. So there's lots of different ways to massage. Oh, the muscle rolling stick. It looks like a what's that called? If you're baking, a rolling pin. It looks like a rolling pin, but you roll it on your tight muscles. So lots of different options for massage. And then lastly, electrical stimulation can sometimes help with spasticity as well. So those are some options of what you can do to release a muscle if it's not releasing due to a high spasticity day. So if you are feeling tight or spastic, but it's temporary, like it's just because you sat too long, maybe in a car ride, maybe on a sofa, anywhere. If you were just sitting too long and you feel like you can't move your body, warm up exercises are my favorite. And so usually I do these in a seated position because typically this occurs from a seated position, meaning you're more likely to feel that level of spasticity when you've been sitting for too long versus standing for too long. So some of my favorite warm-up exercises are back up here. So some of my favorite warm-up exercises, picture me on a couch or wherever you normally would be when your legs get spastic, and you're just going to do some light marches. You'll see I am not lifting that high. I'm just trying to wake up the muscles, wake up the neural pathways. So that would be one. My leg kicks is another. Again, I'm not moving a whole lot. I'm not working on strengthening these muscles. I'm working on waking up the neural pathways. So that would be one. Then you can do toe and heel lifts. Again, it doesn't matter how high or even if they're lifting at all. We're just trying to get the muscles and the neural pathways moving. So what I would do is if I've been sitting in a meeting or you're listening to this for however long and you're feeling a little tight before you get up, maybe just do 10, 15 seconds of some of these marches, 10 or 15 seconds of some leg kicks, 10 or 15 seconds of some of your ankle movements. The reason I like these three in particular is because to walk, to move, to stand up, we need our hip flexors, our knees, and our ankles. So you just warmed up all the big muscle groups you need to stand up and take that first step. So that's why I like those ones. You can do lots of different warm-up exercises. If that doesn't help, what likely is the case is you are feeling your spasticity in a different area. So move that area around. Other things that we can do for spasticity, you could discuss medications with your neurologist. Ampura is actually a medication for walking, and it's FDA approved to improve your walking speed. However, anecdotally, a lot of people have also reported improvements with spasticity. So it's not FDA approved for that, but it's something you could talk to your neurologist about. Baclofen is a really common one, Botox, tizanidine. There's lots of different options, but again, talk to your healthcare providers and see what they might recommend for you. And then another option, focus on a different goal. If you want to exercise that day and your spasticity is making it impossible, focus on a different goal. What other goals do you have that don't require you to move that body part that is spastic? For example, if your leg or both legs are really spastic, do you have any upper body-based goals? Are you working on being able to get your hand and arm up here so that you can brush your hair? Maybe you do some exercises for your upper body. So switching up the goal that you're working on. Okay. Um, when you're used to doing non neuro based exercises, so when I work with a brand new client, again, in person or virtually, the number one thing that I do is educate on neuro based exercises. Because if you are used to doing non neuro based exercises, and this could be anything from classic physical therapy exercises like the clamshell, bridging, side lying leg raises, street leg raises. There's so many different ones. If you're used to doing those, and then now you're being told to do these other exercises, even those warm up exercises that I just mentioned, if you don't understand the reasoning behind it and how and why it's beneficial, you're less likely to stick to it. And so understanding what neuroplasticity is, and I've had other talks on neuroplasticity that are probably an hour long, so I'm not going to dive into it too much today, but understanding what neuroplasticity is, why it's important to exercise your muscles and your neural pathways when you have MS, not just your muscles. If you don't understand the why behind it, and it will likely just seem like, why is she having me lift my legs? This is boring. I don't want to do this. I want to do something more fun. And you can incorporate fun things too, but oftentimes neuro based exercises, at least initially, and for a long while, are going to be the boring ones, but neuroplasticity requires that. And you can make them entertaining. You can add more challenge. You can remind yourself of your deep why of why this is important in the first place. But knowing that when you have MS, to improve your strength, your balance, your walking, your mobility in any sense, you have to be exercising your neural pathways too. And the way to do that is through neuro based functional exercises, not just what you've likely been doing prior to that. A great example of functional exercise would be the recumbent bicycle versus your goal. So often, and I don't know if you guys have ever said this, but so often when I'm first working with a patient, they'll say, I've been to PT before and it didn't work for me. And I'll ask what they did during their PT session. And they'll say, well, I was really great at the bike. They had me do the recumbent bike or the new step every time I was there. And I did it for about 20 to 30 minutes. I got so good at it. I cranked up the intensity level to level 5 and I could do it, but it didn't improve my walking. Well, the way that I want you to think about functional exercise is whatever position you're in is the position you're going to get stronger in. So this person and these people who say that, they're getting stronger in a seated position because their exercise that they're focusing on is seated, but they weren't doing any standing based exercises. And their goal was to improve their walking, which is standing based. When we walk, we're standing. And when you have MS, your brain oftentimes and your neural pathways, spinal cord, doesn't have the same carryover, meaning you can get full strength seated on that bike or full strength lying on that plinth table. And you go to stand up and your walking has not improved at all. And it's because it wasn't functional. You weren't exercising in the right position. So making sure that you're considering that when you're doing your exercises. There's also, sorry, one final thing I'll share. I was at an MS conference recently, and they were sharing how beneficial having a reward is, specifically for fatigue, but even just in general, how beneficial it is to get our motivational loop going and our reward loop. And so we're all different. We have different personalities, but what feels like a reward to you? Like if you exercise today, what are you going to do for yourself today that will feel like a reward? And do that. There's so much research now showing how beneficial it is to have a reward, and that we will actually see faster results if we start incorporating reward versus just like checking off the box, did my exercise today. So just a thought to think of.